right, so with the scoliosis, especially in the adult population, as opposed to the pediatric population, you're going to be treating pain here. So scoliosis in itself is not a painful condition, but once the patient is a little bit older, you start to see disc herniations, stenosis, listhesis, just like with anybody else, just more prevalent with the scoliosis. So what we want to do is focus on treating the pain, and the best way to do that is to correct that lateral shift that you'll see with the scoliosis. The way that we measure that, you can get this at a Home Depot. Use a plumb line, measure at the top of the thoracic spine. You can just use C7. And down to the middle of their sacrum. So just kind of estimate right there. And we can measure, use that as a good objective measure to track improvement. It's really motivating for patients as well. So the best way to treat, or one of the ways we can treat this shift, we don't want to actually overcorrect, so I don't want to be in that frontal plane just doing shifts this way, but instead we want to elongate the spine. So Gina, I want you to put your hands on the table and push up through your arms, head tall, and the moment that we do that, we can see that curve kind of straighten up a little bit here. And now, Gina, I want you to lift your left leg up and hold that. 1, 2, 3, and down. Same thing on the other side. So super simple. We're just going to do a little bit of marching with a mirror in front. She's going to try to keep her nose in line with her belly button, in line with her pelvis. That's going to retrain the brain to tell you where midline should be and redefine where that is for her body, so she can hopefully weight bear through the pelvis a little more symmetrically. Now what we're not going to do is take this prominent right-sided curve and stretch out her QL, which is unfortunately what I see a lot of patients doing. You can take a break, and the moment that they do that, because they feel tight here, now stretch to your left side. We're just going to collapse more into that curve. So instead, we really want to elongate and train the brain where midline is.
Thanks for tuning in to this great presentation. Keep an eye out for more helpful tidbits coming soon to this page on the JAG-ONE intranet. If you have an idea or would like to contribute to this series, please contact someone from our team at professionaldevelopment@JAG-ONEPT.com.